top tested neuro drugs, medication, pharmacology that shows up on the NCLEX in nursing school. Are you struggling with them? I have 17 questions to make them easy. Grab your pen. Let's make this medication memorable with this video. Just one video you'll watch and you'll be able to answer any questions associated with these medications. Let's get to it. First question, what is the priority action? I said this question because it's always a trap. A client prescribes diazepam as what? Slurred speech and difficulty to arouse. What is the priority action? You have to do 1 second, do it so that the patient doesn't get into trouble. What is the next step? Read the answer choice. It said what? Administer naloxone, provide high flow oxygen, give Flumazenil, and notify the charge nurse. Before you answer the question, go with the buzzword. There's one buzzword in the question. Patient was given diazepam. This is what? Benzos. What does benzo do? Depress your neurological status, your respiratory status. Patient has a slurred speech. That means having side effect associated with diazepam. Give them the antidote. That's all. That's your priority action. Notify the charge nurse is not going to help. Giving them medication that doesn't respond to that medication doesn't help. Naloxone is for what? Opiate. It's not benzos. We have benzos. What is the antidote for benzos is what? Flumazenil. Once again, Flumazenil. And that is number 3. Providing high flow oxygen does not solve the problem. All these questions, this is a warm-up, but all the questions are straightforward and start short. Stop the video, answer it, put it in the answer choice, and then let me know as you listen to me. Next question, critical thinking question. What you know, I put it in the critical thinking. What is the next best action? Priority action. And next case for a client, what? Pregnant, who has what? Epilepsy, who must what? Continue phenytoin therapy. Wait for a second. Think about the question. Pregnant lady has epilepsy, number 2, and I'm taking phenytoin. Something should tell you, why do I combine 3 things in that situation? Because when you're pregnant, you should not take anti-epileptic, which is what phenytoin is, because it causes neurotube defect. But what? The question says, who must continue? That means can't stop the therapy. That's the buzzword. Therefore, if you see answer choice that says stop the medication, it's a wrong thing. Test taking strategy. What is the next best action? Recommend switching to valproic acid instead. Administer high dose folic acid supplementation. Discontinue the medication immediately and instruct the client to double dose every other day. Stop the video. Think about it. 10 seconds. Answer it and play the video. Think about it. Which answer choice you want to choose? Patient cannot stop phenytoin. Go back to the pathophysiology of the medication. Phenytoin, the reason why they causes neurotube defect, which valproic acid do the same thing because they interrupt folic acid metabolism. Switching from phenytoin to valproic acid has the same teratogenic effect, right? Discontinuing the medication, mommy is going to have seizures. You're doubling the dose every other day, it's not going to help. You're taking the same thing. What you need to do is to block the effect of the phenytoin on the baby. And that is what? Folic acid. That will prevent neurotube defect. Number 2 is the right answer. When you see this question anywhere, always remember folate. What is the next priority instruction? What would she do? A client with epilepsy is prescribed what? Phenytoin. Another thing you need to know about phenytoin specific is what this question is asking you. Take with milk. Is it okay? Use soft Bristol toothbrush. Is that appropriate? Stop medication if rash appear. What do you think? Take antacid for stomach upset. What would you do? Think about it. Once again, stop the video, 10 seconds. But I'm giving you content so that when you see these questions, you watch these videos multiple times, take note. I want you to take note. When you see them, these are the things they will ask about this medication because those are the high yield fact on these NCLEX questions. Next is questions on pharmacology regarding neuro medication. Phenytoin, you should avoid protein. They hate protein. Is there any protein there? Maybe some milk, right? Protein, right? So you shouldn't take it. They hate it. It causes gingival hyperplasia. Do you see it there? That is what soft Bristol toothbrush means. That means your tooth doesn't bleed, gum bleed. So easy on your tooth and your gum. Stop medication if rash appear. Of course, that is what Stevens-Johnson syndrome, bad effect of phenytoin. But you should not stop it right away, because then you get a rebound. You should let the nurse know or the doctor know. Antacid will affect absorption. Number 2 is the right answer. This is another medication, Carbidopa-Levodopa. You should know for Parkinson's disease is coming, whether you like it or not, in nursing school or the NCLEX. Jot down all the things I'm going to say and remember them and never forget them again. But we'll make it straightforward, not beating around the bush in the easy way, right? Which statement indicate a need for the nurse to intervene. They're saying something wrong about what medication? Carbidopa, Levodopa. We use it for what? Parkinson, right? Because they need what? Dopamine. What are the things you need to know about it? Answer this, select or apply. And then if you get it right, let me know. If you don't get it right, it's okay. These are the things you have to know about it. What are the things you have to know? I take my high protein shake right after the medication. You should avoid protein with Carbidopa-Levodopa. If a patient is on tube feed, you stop it 2 hours. I expect my tremor to improve in a few days. Well, they don't. It takes some time. I change position slowly to prevent dizziness. This is a good thing because it causes orthostatic hypotension. So change it slowly. My urine may look darker than normal. Yes, it changed your urine color, black, brown, red. So that's good. I stop the medication if I notice facial twitching. You can do that. That is side effect, tardive dyskinesia, but you can't just stop it. You alone cannot stop medication. You have to let the doctor know. I receive this medication as a monthly depot injection. It's given as oral medication. These are the things you have to know. The major side effect is tardive dyskinesia, which is number 5, but you cannot stop it. Okay, your urine color is going to change. It's going to cause orthostatic hypotension, and you should avoid high protein diet. So 1, 2, 5, and 6 need intervention. Which of the following the nurse should anticipate as early signs of what? Toxicity. What medication? Phenytoin. Patients prescribed Phenytoin. What should you suspect as toxicity? They are used for neuropsych issue. Every time they give you a medication for a system, the major side effect always goes to the system. That's my strategy. A neuropsych medication for seizure, when I'm taking it, side effect will also associated with that. The early signs of Phenytoin is mostly neurological problem and a slight GI symptoms. Nausea, GI, right? Vomiting, but it's related to neuro. When you're having brain problem, you're going to have nausea and vomiting. It causes horizontal nystagmus. Your eyes is twitching back and forth and slurred speech. Those are all neuro. It does not cause hyperglycemia. So 1, 2, 3, and 5 are neuro side effect of Phenytoin, early side effect. Of course, it can cause ataxia, other symptoms associated with it, right? Gingival hyperplasia, but those are not all neuro. Ataxia is a neuro. But remember, major early side effect is neuro. If you don't take care of it, they're going to coma. Which teaching by the new nurse demonstrate correct understanding of the medication purpose? What medication? Levetiracetam. Why? Patient is prescribed what? Levetiracetam for what? Brain tumor. A new graduate nurse is caring for a client with a brain tumor, and he prescribed this medication. What is the purpose of it? This is a neuro medication. This is test-taking strategy. Think about it. Don't answer it. You don't even know the medication. I know most of these medications, neuro medications, are mostly anti-epileptic. That is the best, except few of what? Maybe Alzheimer's or Parkinson, but most of them are anti-epileptic. That's what they're going to ask you. If it comes to the shelf, you don't know anything, I would think about it as an anti-epileptic, but this is a common anti-epileptic. It's called Keppra. We all know it, but the rare name is Levetiracetam, right? What is the purpose? It's anti-epileptic. You have brain tumor. I'm giving you anti-epileptic. Well, the medication will do what it's used for. The medication will shrink your tumor. That is not anti-epileptic. Medication reduce brain swelling. That's not anti-epileptic. Medication help prevent seizure. Oh, that sounds like anti-epileptic. The medication is used to manage agitation from the tumor. It causes agitation. That's the major side effect. It's another side effect. It can increase seizure, suicide ideation. We don't use it to manage the agitation. You have to give somebody something, another medication to manage the agitation. So seizure prevention means what? Number 3, which sound like prophylaxis for seizure. Test-taking strategy. Which side effects should the nurse report immediately in a client taking valproic acid? Most of these questions you can see, I just give you the most important information, straightforward. Don't beat about around the bush. Single 2-line question, not too many lines. That's what the NCLEX is going to give you. It doesn't give you anything away. Valproic acid, stop it. Think about it. How have you done so far? 7 questions. I know you answer all of them right because you watch Adapting Class. Valproic acid, what is the problem? Think about your liver and your blood. It causes hepatic toxicity and it causes thrombocytopenia. It can cause aplastic anemia. That means your platelet go down. And then what? It can cause pancreatitis too, and also liver dysfunction. Which of this should you worry about? Nausea, hair loss, yellow, sclera, and weight gain. I told you what? Platelet problem, I don't see platelet problem. GI symptoms, I see nausea. Liver, I see yellow sclera. Which one would you pick, nausea or yellow sclera? Yellow sclera means your liver is in trouble. Bilirubin is elevated. That's what I'm going to pick. Weight gain and hair loss is not associated with it. Which of the following should the nurse prioritize? Prioritization 101, something that is going to kill the patient, right? You have to be sharp. A client taking carbamazepine, another anti-epileptic, develop a sore throat and fever. Which of these should you prioritize? Go back to the buzzword. Go to carbamazepine and ask yourself, what is the key for carbamazepine? What is the key for carbamazepine? Because it's agranulocytosis. Therefore, I'm looking for signs of agranulocytosis. Your NCLEX is not going to give it to you. Let's recap. Agranulocytosis. There's not going to be a word for agranulocytosis. You have to translate it to what? Agranulocytosis. Which is that? Reassured it is expected. It's not expected. Sore throat and fever is bad signs. Encourage rest. Fine. It does not answer the question. Notify the provider. Does that answer the question? Administer ibuprofen. You're treating the sore throat and fever. Therefore, just by elimination, number 3, stand alone. You are not doing anything, just letting the doctor know probably will help you that, oh, this is agranulocytosis. But 4 said treat it, 2 said just let them rest, and 1, you're just doing nothing. So 1, 2, and 4, not doing nothing. 3, you're escalating care. Doctor will know that this is agranulocytosis, and therefore it will take care of it. I just put it there so that you know sometimes notifying the doctor is maybe the best answer because the other ones doesn't mean anything. Which statement indicate? The nurse indicate understanding. A nurse teaches a client with what? Levodopa-Carbidopa. I'm going back for recall. This is the way I can help you recall the information we talk about. The major thing I told you about this guy is what? Dizziness, orthostatic hypotension. Your urine color is going to change. You should avoid protein. It causes neuropsychotic issue, tardive dyskinesia. Do you see the answer just there? Does the patient understand this medication? He said, I'll eat high protein meal with the drug. It's okay. Will cure my Parkinson. Do you think it will take care of it? I report involuntary movement. Do you see it there? Dizziness is expected. It's not expected. Do you think so? We all know dizziness is expected. Orthostatic hypotension is expected, right? Involuntary movement is what I call tardive dyskinesia, right? That is what is there. I'm not going to put tardive dyskinesia. Should not expect the NCLEX to put tardive dyskinesia, but the answer choice is there. This is how you got to apply some common sense and test-taking strategy in looking for answers that you already know. I'm hiding it, but you find it because you watch Adapting Class, and you should give yourself a pat in the back. It will cure my Parkinson. No medication cure neuropsychotic issue. You should avoid high protein diet. 3 is your right answer. Which client should the nurse question a prescription for Benztropine? And ask for several clients on the neuro ward. Which client? Client with glaucoma, bradycardia, tremor, depression. Let's do some work. Benztropine, you may not know what it is, but look at the last name. Always pharmacology, look at the last name. Does it look like something you know? If you take B-E-N-Z from there, it has tropine. What can you put in front of it? That sound like something you've seen. Atropine. So, atropine is used for what? To help with your anticholinergic effect, right? That is what it does. Atropine, anticholinergic effect. If you take the Z from there, it becomes atropine, anticholinergic effect. Therefore, this medication is anticholinergic. Which condition anticholinergic is bad? When you are bradycardia, if I give you atropine, your heart rate goes up. It's a good thing. Tremor, depression, right? But glaucoma, if I give you anticholinergic, you're in trouble. You worsen your glaucoma, increase your intracranial pressure. Therefore, number one, we should worry about it. And next, care for a client prescribed lorazepam, which is benzos. It depresses your neurological status, your respiratory status. Therefore, what do you think? Sedation, dizziness when standing, shallow respiration, and drowsiness. All of them are bad. But which one is bad? Bad of all badness, right? Number three, shallow respiration. Which of the following instructions the nurse should prioritize? Prioritization 101. About which medication? Topomat, right? Topiramate, or you can say Topomas, is the same thing. It's anti-seizure medication. If you don't recognize it, I say go back to anti-seizure medication. But now you know that it's anti-seizure medication. Which one should you prioritize? Increase your sodium, schedule a doctor visit, expect increased sweating, and take with milk. Don't take with milk. Don't increase your sodium. One of the biggest side effects is it causes glaucoma. Therefore, you should go see your surgery. Ophthalmologist, number two. These are little things. If you know about this medication, trust me, when they ask you, the answer choice is popping out like a candy. Like I know Topomas, I need to worry about what? Glaucoma or eye problem. I need to go see a doctor. That's all. The rest, know that it's used for seizures. And if it's used for seizures, it's a sulfur drug. It causes all the sulfur drug symptoms. Which, and next care for a client prescribed gabapentin, right? Gabapentin, prescribed gabapentin. It's also anti-seizure medication, but it can be used for other things. Which of the following instructions the nurse should prioritize? Take the medication in the morning to prevent insomnia, expect rapid pain relief, avoid driving for a few weeks, and increase dose if pain returns. It's used for seizure medication, but it's good for pain management, neuropathic pain. It causes sedation and weight gain. Don't forget, sedation and weight gain. Therefore, taking in the morning is going to worsen your sedation, right? It doesn't prevent insomnia. It makes you sleepy. It doesn't work right away. It takes some time. You should avoid driving a few weeks because then you can, so that you can know how the medication is going to respond to you. Don't increase the dose if the pain returns. You got to talk to the doctor. Number three is your right answer. Which assessment findings should the nurse prioritize? The nurse care for a client taking lamotrigine. Once again, anti-seizure medication. Like I told you, most of them, they have anti-seizure medication. But I told you it's used for epilepsy. What should you worry about? Fatigue, diarrhea, small purple rash on the torso, increased appetite. This is to give you all the content regarding sulfur drug. Most anti-epileptic are sulfur drug. As soon as you're able to recognize them as anti-epileptic, think about it as sulfur drug. Sulfur drug, they call it, the biggest side effect is what? Stevens-Johnson syndrome. Otherwise, they causes other things. They causes stone formation, right? Kidney stone. You got to drink a lot of water. Avoid being on the sun for a long time. So one of the major side effects, small purple rash on your chest, and that's Stevens-Johnson syndrome, number 3. Valproic acid, we've seen it. I'm testing you again. And I told you it affects your liver, right? It causes pancreatitis and it causes thrombocytopenia. Which lab work would you check? I put troponin in there to trap you. Potassium there to trap you. But you know the content. You know it has nothing to do with them. Just because there's potassium there and troponin doesn't mean I have to pick it. I know the content. I'm going for the content. And that content means platelet is my answer. Do that when you're taking your NCLEX. Don't let them trap you. Don't let me set you off and pick answers you don't want to because you see it is bad. And no valproic acid causes thrombocytopenia, causes liver dysfunction. I'm looking at it and say, oh, platelet, thrombocytopenia, I pick it. And the last question, what do you think? Levetiracetam is Keppra. We use it for seizure medication. And I explained to you some of the things you should know. Stop taking it if you feel better. Is there a good teaching from a nurse? This can cause mood changes, agitation. This causes dry mouth. It needs blood level monitoring. This is the only medication that you don't need to check blood level. Levetiracetam doesn't need blood level, right? It can increase your neuropsychotic features, agitation, right? Depression, suicidal. It doesn't cause dry mouth. And you should not stop it because you feel better. Then you have a seizure problem. 17 questions, over 12 medications. Top testing one. Pharmacology, using NCLEX questions and answers, NCLEX review questions to master this. Thank you for watching. Thank you for following the series. Good luck and all the best of luck.